Welcome to the Practice of Medicine podcast from the Southern Medical Association. Since 1906, the SMA has had a singular mission to provide medical professionals with the resources they need to learn from each other, and in so doing, to improve the overall quality of patient care. The Practice of Medicine podcast is just one of the ways we do that, as we discuss a wide range of topics, including multidisciplinary approaches to patient care and new innovations in medical technology. To learn more about SMA's many other services and educational initiatives, please visit us at sma.org.
I'm Dr. Lisa Fitzpatrick.
And I'm Dr. David Malebranche.
So David, let's talk about the patient-physician relationship in HIV care. You know, it's sometimes difficult to have conversations about how every provider can't take care of every patient. I often tell people I wish we had a match.com for doctors and patients. And the reason I think that's important is because people who might feel connected, feel a connection to you as a provider might not have that connection with me, and that's completely okay. There was a gentleman who would come and see me, and he would clam up every time, and I always knew there were more things he wanted to say, but he just couldn't. So finally one day I said to him, "Would you rather have a male provider?" And he said, "Is that possible?" So I transferred him to one of my colleagues, and there was no shame. I didn't feel offended in any way. In fact, he got on great with that gentleman, and has been undetectable ever since. I mean, that was my biggest concern, that we weren't connecting in a way that was best for his health outcomes. And I think it's important for us to recognize that, especially if it's impacting a patient's adherence or engagement in care.
Yeah, I think it's tremendously important, and I couldn't agree more. I was actually, as you were talking, I was thinking back to times where I've had women as patients. And also, I remember in particular a younger student when I was working in student health who was Muslim and came in for some upper respiratory infection. And she was really nervous when I came in the room. And I said, "Would you prefer, or is it, I said, "You're Muslim, correct?" She said, "Yes." And I said, "Are you allowed, or do you approve of having a male provider, or should you have a female provider?" He said, and she said, "Yeah, definitely, I want a woman if possible." And so I didn't take any offense to it either. I just kind of went in and did what I needed to do. I think it's important that two things can exist in the same space when we talk about, the patient-physician relationship and HIV prevention and treatment, so on and so forth. I think there's room to acknowledge that patients deserve to get what they prefer at some point. And so for me, I remember doing some focus group studies when I first started, doing public health and working in research. And we had focus groups with Black gay men in various areas in New York and New York City. And we asked them pointedly, does it matter as Black gay men whether your providers are Black, whether they are male, whether they are gay or queer? What do y'all think is their preference? And it was all over the map, Lisa, what they would say. Some of them would say, "I want a Black woman because then it's going to remind me of my mama." And then another one would say, "I don't want a Black woman because it's going to remind me of my mama." And then some people would say, "I want a gay doctor because they'll understand where I'm coming from." Another one would say, "Well, I don't want a gay doctor because I may be attracted to them, and I don't want to."
You see why we need a match.com for doctors and patients.
Right. So it's exactly it. So, but at the end of the day, the most common response that we heard from these gentlemen was, "I don't care, just be good." And that resonated with me a lot because what it said was, I think people are smart enough to realize, or based in reality enough to realize, that you're not always going to get a direct concordance of, it's not going to be a match.com where you're going to have someone who fits all those check boxes or matches all the intersecting social identities that you have. but they just have a white coat on, or they just have the training of a PA or a nurse practitioner or a medical doctor. So you may not get that. So they want you to be good. And by good, they meant listening to me, respecting me, treating me the way I'm supposed to be treated, not withholding medication or withholding treatment based on what you think I am, but be good. And a lot of it was more about the energy and the psychosocial aspects of that connection with that provider that they felt were important. Now, I can say that from a research context and from doing the work over these past 2 decades, particularly with Black gay men, that it may not matter. But I can also say in the same breath that it does matter, because I know for myself as a Black same gender loving man, when I step into the room and I talk with another Black same gender loving man who is newly diagnosed with HIV or along the continuum, we can say things to each other and we can clown about certain things. And there may be certain cultural references that I will get that will make them feel more comfortable, like they're at home or like they're with their friends, or they're having a discussion at a brunch on a Sunday afternoon with someone who just happens to have some medical advice as well to give them. And so I think people can just be good and really make people feel comfortable and achieve the outcomes of engaging in care and viral suppression that we all look at in HIV prevention and care. But I do think there's something to that relationship, especially if it's going to be a long-standing relationship, that if you have some commonalities with that person, that it's going to be very fruitful and will encourage, further engagement and follow-up like that. So I think both can exist.
We hope you enjoyed the practice of medicine. For more episodes in this series or the SMA's Business of Medicine podcast, go to sma.org/podcasts or subscribe to us on Apple Podcasts, Google Podcasts, Spotify, or wherever you get your podcasts. For more information about the SMA's mission, please visit sma.org, and thank you for joining us.